Good afternoon, Clark Tailhood. Let's begin the warm-up session. What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers. What do you find rewarding about being a nurse? I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding. How do you deal with someone who isn't satisfied with your patient care? When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care. Tell me what you feel your greatest skill as a nurse is. My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care. How do you handle the stress of the job? To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients. Good afternoon, I'm Nurse Clark Tailhood, and I'm here to assist you. May I know your name please? My name is Mihiraa. Hello Mihiraa, can you tell what brought you to the clinic today? I'm afraid that my son Ryan might develop dental issues as he's growing older. He is 5 years old now. I just need some advice on how to take care of his teeth, especially since children have different oral health needs. It's completely understandable that you're worried, especially when it comes to children's well-being. I really appreciate your concern for Ryan's dental health, Mihiraa. You're taking the right step by seeking advice early. Taking care of oral hygiene is crucial for children at this age, and I'd be happy to guide you through the best practices to ensure his teeth and gums stay healthy. First, let's talk about brushing, which is the foundation of good oral hygiene. Ryan should be brushing his teeth twice a day, once in the morning and once before bed. It's important to use fluoride toothpaste for better care and protection. Now, let's discuss the brushing techniques. When applying toothpaste to the toothbrush, only a pea-sized amount is needed. Brushing should last for about 2 minutes, and it's essential to clean all surfaces. This means the back teeth, gums, and even the tongue. I hope it is clear to you. Yes, nurse, and I've heard that fluoride is necessary, but I worry whether it's safe for children. Is fluoride really something he should be using at this age? I understand your concern, Mihiraa, and you're right to ask about fluoride. It's actually very beneficial for children because it helps strengthen the tooth enamel, which is the protective outer layer of the teeth. Strong enamel makes the teeth less vulnerable to decay and cavities. Fluoride in toothpaste is safe for children as long as it's used in the right amount. Like I mentioned, just a pea-sized amount is enough. You can also check if the local water supply contains fluoride, which can offer additional protection for Ryan's teeth. So, rest assured, it's completely safe when used properly. That's a relief. What else should I be focusing on for Ryan's teeth? Along with brushing, flossing is just as important, though it's often overlooked. Mihiraa, I will guide you through it in detail. Flossing should be done once a day, ideally before bedtime because it cleans the teeth that a toothbrush can't reach. It removes food particles and plaque that can get stuck in those tight spaces, which helps prevent cavities and gum issues. Since Ryan is still young, he might need your help with flossing until he's a bit older and can do it on his own. You can make it easier for him by using child-friendly flossers, which are designed to be more comfortable for kids. How does that sound? That's informative. I understand that, but the real challenge is getting him to do all this. He's very hesitant, and it's hard to make him brush, let alone floss. Suggest ways to M. That's a very common struggle, Mihiraa, and you're not alone in dealing with it. Children often resist brushing and flossing, but there are ways to make it more fun for them. For instance, you can use a timer or play Ryan's favorite song to make sure he brushes for 2 full minutes, which turns it into more of a game. Letting him choose his own toothbrush with his favorite color or character can also make him feel more excited about the process. And of course, offering praise or a small reward after he finishes brushing or flossing can be really motivating. In addition to brushing and flossing, a balanced diet is important for Ryan's oral health. Encourage him to eat fruits, vegetables, and dairy products, while limiting sugary snacks and drinks, which can lead to cavities. That sounds helpful, surely I will try them. But nurse, is there any way I can tell if he's having any dental issues early on? Yes, Mihiraa, there are definitely signs you can watch out for. If Ryan starts complaining about tooth pain or sensitivity, that could indicate an issue. Visible decay, like brown spots on his teeth, or swelling in the gums are other warning signs. However, the best way to ensure his teeth stay healthy is to bring him in for regular dental checkups. It's recommended that children visit the dentist every 6 months for a thorough cleaning and examination. This allows the dentist to catch any potential issues early and prevent them from turning into more serious problems, like cavities. Mihiraa, Do you have any other concerns or questions? Thank you for all the information. This has been really helpful. You're very welcome, Mihiraa. I'm glad I could help ease some of your concerns. Ryan is lucky to have such a caring parent, and with the steps we've discussed today, you're setting him up for a lifetime of healthy smiles. If you have any more questions, don't hesitate to reach out or ask during your next visit.